If you are smoking and you are over 50, and you have high blood pressure, like you need to stop. You need to somehow use the skills and tools, research, get a therapist, get a, behavioral therapist that can help you with behavior modifications. Hi, welcome to the Judy Terrell Show, where I explore topics intended to optimize everybody 50, 60, 70, and above. Hello, everybody, and welcome to your second 50 years on the planet. I am Judy Terrell. I am a nationally board certified health coach and also personal trainer and nutrition coach and weight loss coach and yoga instructor and master's degree in counseling psychology. I have a lot of credentials that allows me to stand in front of you and tell you that I have some information that will benefit you. And I've targeted a demographic 50 plus, not just women, men and women both. I am 60 myself. For the last 10 years out of my 40-year history of working in the industry, I have specialized in over 50 because I want to make sure that the information that you are getting, if you are over 50 yourself, is applicable to us that are over 50. A lot of information out is not, and then therefore we're using old information, trying to follow things that are not going to work for us. So if you are joining me in this episode, then you are on the last of the 6-part series that I have done on how to use behavioral medicine to reduce blood pressure when you're over 50, as a male or a female. And this is, as of this moment, still predominantly higher in men than females, but females were catching up. All right. So I want to give you tools that are what I call behavioral medicine. So what I mean by that is the things that I am telling you about are things that you can do on a day-to-day basis as part of your living of everyday life that have effects in your body that can help to prevent, minimize, or reverse chronic illnesses. All right. In particular, right now, this series is addressing high blood pressure. All right. This is the last episode. So if you have not looked at the other 5, please go back and find those because they all add up together. And this last one that I'm going to focus in on with the topic for this one, excuse me, is 2 things that we all do on some level. Some of us don't, but many of us do. And they have a negative effect on blood pressure. And the 2 things I'm going to address are smoking and alcohol consumption. All right. It's amazing to me, honestly. I'm recording this in October of 2023. It's amazing to me anybody still smokes. The negative science that shows that it's it's basically putting a gun up to your head is, clear. But yet, interestingly, I just looked this statistic up. 12% of people from the age of 45 to 64, 12% of that population demographic smokes, and 8% from 65 up. 8%, that's still a pretty high percent relative to the knowledge we know about that behavior, smoking. All right. So, I'm not here to tell you, try to convince you to stop necessarily. My agenda is to give you information that might help your, kind of like algorithm in your brain as to your motivational schedule or motivation for stopping smoking. All right. Because there's no doubt smoking affects blood pressure in a negative way. So if you're already diagnosed with it, like smoking is like, you're adding lighter fluid on a fire. All right. So let me tell you why and how that works. So when you smoke, as you're smoking, your heart rate increases. You are doing damage to the walls of your arteries from the nicotine and the other things in smoke that get into your lungs and then are picked up by the blood and then transported through the bloodstream. And then as those elements are in the bloodstream, they can do damage to the walls of the arteries. When there's microscopic damage to the walls of the arteries, your body is going to produce inflammation to try, just like if you had damage on the outside of your arm, skin, it would get red and it would get puffy and infected. Not infected, but it might get infected, but the immune system would make it puffy and red because that's what it does when it's trying to heal. But when that's happening to inside all your arteries, you are now at a much higher risk of arteriosclerosis, like fatty elements that are in the blood always, kind of getting stuck on them, calcium deposits, all sorts of things that now narrow the arteries, continue to do damage to the artery wall, and then make a narrower, vessel for the blood to flow through, which makes your blood pressure, your heart and your blood have to have more pressure to get through. And that is how smoking affects your blood pressure. I'm not even going into what it does to your lung tissue, because this episode is about what to do to lower your blood pressure. So now that you understand how smoking hurts your arteries and then produces narrowing and arteriosclerosis, that might, have a different, now that you understand the mechanism, you might have a different motivational schedule for either smoking in general or lowering the number that you smoke per day, because that can help too. Somehow modifying your smoking, if not giving it up. You are definitely doing damage to the arteries in your body. It's affecting your blood pressure immediately, but it's also affecting much other things that I'm not going to address in this specific video, but you are damaging your body. Not to mention the fact it's very expensive right now to smoke. But, so behavioral medicine for reducing blood pressure, one of the main things you can do is if you smoke, stop. If you're not willing to stop, cut down, and maybe try and get the nicotine, if it's a nicotine you're actually addicted to, through another source like the patches that are out. But I have found that many of my clients are not actually, the nicotine addiction is not the catch for them. It's actually the ritual of smoking and the breathing, and the, you're, after you've done something, you sit down, you relax, you have the cigarette. And I would argue as in discuss, that the main thing that you're getting out of that is the cigarettes have kind of been Pavlovian conditioned to the relaxation effect. And you can do that without smoking. Just sit and take, an inhale and then a deeper exhale. Because when you smoke, you inhale and then you do, and that longer exhale is a relaxation breathing technique that's used to de-stress. So do it without the cigarette and see what kind of effect you have. That might be all that you're looking for, or significantly notice that that's the relaxation effect, and that can help you to cut down, if not quit, right? But point being, smoking correlation with high blood pressure is like 100%. And so that is a behavior that you need to change if you have high blood pressure and you're looking for a behavioral way to help to control it. I am so excited to announce your second 50.life. I have been working in the fitness industry with individuals, both men and women, over 50 years old for 42 years, and really specialized in the last 10 on over 50. I'm over 50 myself by a long shot. And I've helped literally thousands of men and women both to lose the extra body fat that they gain in the second half of their life. 2, feel better in their own bodies energetically. I have helped people to reverse and eliminate health problems, high blood pressure, high cholesterol, pre-diabetes, symptoms of menopause, to name just a few. On this platform, you will have access to an entire body of resources, exercise videos, mini courses, eating plans that are specially designed for over 50 men and women, because there's special needs for our demographic. And in addition to the virtual resources that you'll have access to if you join at any time that you'd like, you also have access to me for one-on-one coaching through a group coach call every month. So you can bring your specifics and we can address those as you're also getting information that is specific to the over 50 population. 50s, 60s, 70s, and now 80s is the demographic that I'm working with. So it's your second 50.life, YOURSECOND 50.life. Go check it out. It might be the single best thing that you've looked at like in your second 50s. If not, get rid of it. All right, the second consumption behavior that we can address is alcohol, because alcohol consumption, again, about 2 months ago, a meta-analysis came down the pipe. A meta-analysis is when the researchers look at not just one study of a certain number of people, but they look at hundreds of studies done with hundreds of people, and then they kind of they analyze all of those together, and they come out with what's the conclusion from looking at everything. And oftentimes, like, some interesting things come out from doing that kind of a observation that you didn't see from the individual studies. And 2 months ago, the CDC came out with a meta-analysis about alcohol, reversing and throwing on its head. The prior recommendation was you can have like 2 drinks a day for females, 4 drinks a day for males. There were some health benefits, and other things that they suggested that might make that a good practice. And this meta-analysis wiped all that out. 0 amount of alcohol has any benefit and has liabilities. And the recommendation now is no alcoholic drinks at all for health and well-being. Interesting, right? All right. So now, my average client who's 50, 60, 70, 80, 90 even now, many of them, if not all, most of them, aren't willing to give up drinking completely, although some do. I don't drink. I haven't drank alcohol. I might take a sip of something to taste here and there, but the negative effects I noticed in my own body made me quit when I was in my 30s. But what I'm suggesting to you is some people might say, you know what, it's not worth it to me. I don't want to. I have high blood pressure, and if alcohol is related to that, I'm going to stop. Good for you. Most of my clients are not willing to go cold turkey and stop and never drink again. So let me tell you how alcohol enhances high blood pressure, and then we'll talk about how to handle it if you're not somebody willing to give it up. Okay. So alcohol, a lot of times people think it's good for blood pressure because it's like relaxing. When you first initially ingest it, there is a reaction of the blood pressure going down. All right. But 12 hours and 24 hours later, then it results in a higher blood pressure. Because alcohol is actually doing damage to the arterial walls. For that reason, I'm looking at my notes here because I wanted to get a particular specific point in. That then causes inflammation and then narrowing of the blood vessels, which then causes high blood pressure. So the alcohol is doing damage to the arterial walls, similar to smoking, and that is one of the main reasons why the alcohol is a bad for blood pressure. Another thing that it does is it causes changes in the blood pressure, and then it also does some changes because then your body has to, within 12 to 24 hours, work harder because then it widens the blood vessels and narrows them in a longer term reaction. Now your heart has to work harder to get the blood through these narrower arteries, and that can cause heart damage, heart tissue damage, and also arrhythmias. Drinking alcohol is now related to heart arrhythmias, which a lot of my clients who are over 60 are getting diagnosed with. So for a variety of reasons, alcohol is actually doing damage in the body that's directly related to then your body having to have a higher blood pressure. With the alcohol in particular, it's a systolic number. The pressure it needs to, when it beats, that's the upper number in your blood pressure, is higher because it's got to work that much harder to get it through because of the reactions of the blood vessels and the reaction in the heart muscle itself to the alcohol. All right, so those are the explanations as to what's going on in your body as to why smoking and alcohol consumption in particular, those two habit patterns are bad for blood pressure. We already talked about the nicotine, do the relaxation breathing without the smoke and the cigarette. If it's a nicotine addiction, try to use the patches to get the nicotine as you're trying to wean off. If nothing else, if you're a 10 cigarette a day smoker, see if you can reduce it down to 5. There's techniques for reducing, if not stopping, smoking. When it comes to the alcohol, similarly, you might decide when you kind of know, it's damaging my heart and my arteries, not just my liver, which I'm not, my liver enzymes come back in my blood fine every time. I hear this from clients, so I must be fine, but they have a heart arrhythmia. That could be related to your alcohol consumption. So knowing now the mechanism and that the alcohol is related to blood pressure issues, that might be enough to say I'm going to stop, or I'm only going to drink on weekends. Or another way is, it was recommended 4 alcoholic beverages a day is okay for men and 2 for women. like I said, now it's 0 for both, but you might say, all right, instead of 4, I'm only going to have 2 of a meal, or I'm only going to have 1, or I'm only going to drink on weekends, not during the week, or I'm only going to drink every other weekend on weekends. You've got to come up with like a kind of a pattern that you're aiming for, like a plan that you then hold yourself to. Because if you just say, I'm going to drink less, there's no structure to that. But if you say, I'm going to drink alcohol only every other week versus giving it up completely, now you're starting to have a plan that you can actually execute that will help to reduce it, if not eliminate it. And that reduction will have a reduction on blood pressure over time as well. All right. So, my end point here is that if you are smoking and you are over 50, and you have high blood pressure, like, you need to stop. You need to somehow use the skills and tools, research, get a therapist, get a, behavioral therapist that can help you with behavior modifications, but you got to get that out. Like, that's just, a given. When it comes to alcohol, most people have that as part of the fabric of their life, especially the clients I work with that are over 60, socializing, parties, get-togethers, book clubs, all sorts of things. If you're not willing to eliminate it, don't want to eliminate it, then try to modify it, but modify it with a structured plan so that you can say, I either was successful at that or I wasn't, or you have a criteria that you can follow versus, you said, I'm going to modify my drinking, but then you get in a drinking situation and there's no plan. So therefore there's going to be no execution. You're going to do exactly what you would normally do because we're autopilot behavior animals. Okay. All right. So my point, again, I know it's not lost on you, but one more time, if you have high blood pressure and you want to do something that's not pharmacology. Oh, and by the way, even though you're taking the medications, you're not stopping the damage that's being done that we just discussed. It's just a matter of time before your medication will go up, or you have to go on 2 medications, or I have clients that are on 4 medications for blood pressure and still have high blood pressure because they're not doing the behavior modifications. All right. So, the medicine is not going to reverse the damage from smoking and alcohol, because these 2 particular habits, 100% in any amount going into your body, are damaging. All right. So thank you for joining me in this whole series, because this was episode number 6 of a 6-part series on what you can do to reduce blood pressure when you're over 50 as a male and or a female. All right. Please, take a look at my website. I've got all sorts of products on there that can benefit the over 50 population, of which I am one. It is my goal, because I'm in a position to get the information, I can homogenize it down, siphon out the stuff that's not related to our age group, and then put it together for you, who's watching. I have Your Second 50 platform, which is a huge resource database, videos that I put like this, that you can watch and listen to, that are all related to just our age group, 50 plus, second half of life. And so please check that out. And, I'm happy that you joined me. Please subscribe to the station, like it so I get more play and can hit more people. And you got this, more information and now application. And you got this. And then before I see you again, in the meantime, celebrate every moment that you have on this planet. Every day is sacred, and be well until we meet again. And if you'd like to have access to some of my additional resources, I can be found at Facebook, Instagram, YouTube, and on my website, www.judyterrell.com.